Now we're going to do the AP proximal femur. This is just assuming you get femur, okay? And on the practical, this is one of the positions. Okay. Femur is going to be head of the femur, greater trochanter, and it's going to taper back in. Okay? So as it tapers back in, our marker should be low to the outside. Okay? And if there's enough overlap on there, you know, if you put it on the table, you can put it on the table, that's where the overlap's going to come in. Because when you use a small film, then it's not overlapping. But if you put it on the outside part of the table, then it'll overlap. Okay? But I'm just going to, actually let me go ahead and do that so you can see it. Scoot towards me a little bit, please. A little bit more. Sliding on over. If you tell them to slide over, then they won't try to turn on their side. You know, some patients you tell them scoot over a little bit, they'll actually roll up on their side, and you're like, no, I don't want to do that. Just slide over. Just scoot your butt this way. You know, something to get them to do it the way you want to do it. Because some people, you keep saying the same thing, scoot over this way, and then you're just going to keep trying to roll on their side. Make sure that you tell them a different way. They're just not getting in. Okay, so what we're going to do, scoot this over, okay? Remember that the leg is going to go immediately, so you need to scoot this leg in to get this lined up as straight up and down as you can here. So what we're going to do, find ASIS right here, okay? Light field, just below the ASIS, okay? That way you'll get the entire femoral head, greater trochanter to the outside here. Okay? It's not going to be above the ASIS because if you look at the anatomy of the pelvis, you see that the hip is definitely below the level of the ASIS. So you can collimate to your size of film, whether it's a 10 by 12 if you're just doing a unilateral hip, or a 14 by 17 if you're doing an AP femur. Get that on there. So find the ASIS. We're going to rotate this leg in, okay, because we want this to be true AP. This hip can just relax out here. Okay, we're not interested in bending both toes together. That's just on a pelvis foam. So as we rotate that in, our light field from top to bottom looks about right, because if you imagine where the knee is and you do a 10 by 12 for the knee, it's going to overlap that lower third there. So you got to kind of visually look at it to see if it's in the right spot as well. Okay, marker down low. The inside, remember there's going to be some muscle here, so you can really push it in a little bit underneath the skin line here. And if you put it there, when you go to do your knee series, don't move your marker, okay? That way you know that it's definitely overlapped. You can see both parts of your marker on there. Okay. Here, shield across the inside, because we're just interested in the acetabulum, okay? Get the acetabulum on there, which is on the outside part of the film there, and you shouldn't be anywhere near the gonads, okay? If it's a female, you can put it in just like you normally put it in, but for men, just along the medial border here. Okay, make sure the greater trochanter is on there. You can find it, you can palpate it pretty well. So if it looks like it's like way out here, then you would have to definitely move him over a little bit closer to you. Okay, but his greater trochanter's right here, and we've got a little bit of light outside of that. Okay, so we know that we got the greater trochanter. Could he probably even come a little bit more to the outside. So about right there. So this is your APproximal femur, okay, with the big film. So if you're doing an APproximal femur, I want to see this big film on this. I want you to do this like you would do it in the clinic. Okay? So if you were in the clinic, you were to complete it out, then you would just do an AP knee, no angle. Okay? Definitely no angle on this one. If you're using 5 to 7 on your APs, that's fine. But on a femur, we don't want to see the angle because we're not interested in the plateau. We're just interested in the one big bone, straight AP. So we throw an angle on that one. Okay? So AP proximal femur, and then AP knee just to complete it. Okay? The only difference on the AP knee to complete it is that normally you're going to be centered just below the apex, okay? That way it gets equal parts of tib, fib, and femur. We don't need that when we're doing an AP femur, okay? When we're doing an AP femur, we just need to see the femur. So assuming this is our 10 by size, find the apex of the knee, and then just center that, just so that's a little closer inferior now, okay? You see where our marker is now? Now our marker is still on there, so we know we got some overlap on that. So I say AP knee, I'll just do an AP knee. Do an AP knee, but center a little bit more towards the femur because you're doing a femur series. Now you just put those two together, and you got the AP femur. Questions on that?